Start. Okay, I want to welcome everybody to this Rainforest Friday. You can see my wife coming into the picture. I'd like to welcome those that are part of the Parkinson's support group or people that are interested in learning more about Parkinson's. But today we have a really great team assembled to talk about living during this unprecedented time with a loved one or yourself has Parkinson's. We'll talk about Parkinson's. I'll introduce Deetra and the team members, and then Deetra will go and do a bit of Parkinson's 101 for us. So I'm very excited about that. So I'm just going to get right to the show, and I always like to start with either a great quote or a fact. But those that are familiar with Parkinson's, I was surprised to know that 10 million people worldwide are living with Parkinson's. That's quite a big number, and the incidence of Parkinson goes up as you age. So this is a very real thing, and everybody involved in this presentation has either cared for or has a loved one with Parkinson's. So we're all in it together, and I'm very excited about this session. It's our first one with Parkinson's, where we're covering this as a topic. So I'd like to go over how this is going to flow. I'm going to start with some quick introductions, and then I'm going to introduce Deetra. Hopefully you've read all the bios up there of this team. It's kind of like the A-team. But Deetra will talk about Parkinson's. And then we found success. We've been doing these since the beginning of April, where we create a fictitious character that is inflicted with dementia or Parkinson's, and then the elder care team talks about how we can help. And the whole purpose is education. And one of the things is powerful in our community, and I'll have to put resources for seniors at the top of the list. There are amazing resources that you can reach out to help. And those of you involved with a support group, God bless you and kudos, because support groups are probably the most fabulous thing you can do to be together with other people experiencing what you're experiencing and draw from each other. So without further ado, just want to introduce today's team. First is my wife, Gina Murray. Together, we started Aware Senior Care. We are a home care company in 2014, and Gina's the heart and soul of what we do, registered nurse, been in geriatric care since the beginning of time. But she's a wonderful person understanding home care. Micah, we have two Micahs, Micah Kilgore, our administrator, but Micah is from she is the Triangle Area President for Life Links. Mike is a wonderful soul spirit. We met Micah years ago, originally from Germany. And Life Links is a godsend where whatever issue you're experiencing in elder care, you may hear the term aging life care professional. They can help manage the whole situation holistically and work with people, everybody on this call. So they're kind of like a life coach, but they're elder care experts, and Micah has cared for people with Parkinson's. She'll speak to that. A lot of you are familiar with Susan McGuire. We've had the privilege of knowing Susan since we started the agency. She's always been so open and gracious in suggesting education, and we've done education together, and she's part of the Resource for Seniors organization, a great organization to support elders, seniors. And then Deetra Buxton. Deetra is from UNC HEALTH. And she was waving there shortly. She is our subject matter expert and therapist, and graciously volunteered her time to educate us about Parkinson. And then she will introduce our character, which she created, and we're going to all speak about that character. So what I'm going to do is I'm going to stop sharing my screen, which I just done, and Deetra, you can take it.
All right, sounds good. Let's see. I'm clicking on screen share and it's saying host disabled participant screen sharing. I wonder if there's something different that we need to do.
I think we have to make her a co-host, Tim.
I did originally, so I wonder if I can make see, there's Deetra. Okay, yeah, I originally did. Thank you. Deetra, try it now. I think I fixed it.
Yes, got it.
Excellent.
All right, cool. Are you guys seeing my screen?
We sure are.
Great. All right, so thank you for the introduction, Tim. Again, I'm Deetra Buxton. I'm a physical therapist at UNC Health, and I work at UNC at an interdisciplinary clinic called the Center for Rehabilitation Care. And one of the things that we do there is host a monthly interdisciplinary clinic for people with Parkinson's disease, and then we have another clinic for people with atypical Parkinsonisms. And so we have people come really from across the state. And in one day they see a physical therapist, speech therapist, occupational therapist, social worker, and then a neurologist who is a human movement disorder specialist. And at the end of the day, we talk about some of our recommendations and sort of kind of help people prioritize what we think they should do next in order to best manage their disease. So it's a really wonderful clinic. They have something similar at Rex as well. And then I also see people with Parkinson's disease as part of my regular practice in the clinic. So yeah, I'm delighted to be part of this webinar, and I hope everyone gets something out of it. So today, first we're gonna do just a brief overview of Parkinson's disease, and then we'll go into some exercise recommendations for people with Parkinson's disease, and then I wanna share some resources that hopefully people will find helpful, especially during the COVID pandemic. So to just briefly start talking about Parkinson's disease, most of you likely already know that Parkinson's disease is a neurodegenerative disorder that affects dopamine neurons in specific places in the brain. And this lack of dopamine causes both motor and non-motor symptoms. So some of the most common motor symptoms are tremor, and that could be a tremor in the arms, legs, jaw, or a sort of a postural or trunk tremor. Another common symptom is movement slowness. Another is stiffness or rigidity, especially in the trunk and neck muscles. And then we also tend to see problems with walking and balance. And then in addition to the motor symptoms, most people have non-motor symptoms, and these are less talked about, but also really common. So some of the most common non-motor symptoms are apathy and depression, in addition to constipation. And I bring up constipation because we have an entire specialty in physical therapy called pelvic health, PT, and they tend to deal with problems related to pelvic floor musculature. And so we have a pelvic health therapist on our interdisciplinary Parkinson's team, and she does excellent work helping people with issues related to constipation, sexual dysfunction, and also urinary frequency and incontinent issues, which are also common in Parkinson's disease. And I also wanted to just make sure that we touched on apathy and depression as two of the non-motor symptoms, because we'll talk a little later about how much they can affect quality of life. And some people, tend to think of Parkinson's disease just as a movement problem, but they don't recognize that lack of dopamine in the brain can also result in some of these mood symptoms. And it's an important thing to bring up with your doctor if you are experiencing apathy and depression or other mood symptoms. So we're going to talk about all of the problems that we see in Parkinson's disease, but I think it's good to know that Parkinson's disease, generally, many of the symptoms are treatable with medications and therapies. They're highly effective, and they help people maintain a really great quality of life. So if you want to know more about all the specific stages of Parkinson's disease, I provided a link here. Generally, as time progresses, people notice more difficulty with walking, balance, and posture. Another problem that tends to occur over time is on the development of on and off periods, also known as motor fluctuations. So typically what happens is somebody takes their dopamine replacement medication like Sinemet or carbidopa-levodopa, and let's say they take their medication at 8 in the morning and their next dose isn't until 12 o'clock, like until noon. And so they might notice that around 11 o'clock, a lot of their symptoms start coming back. So they're feeling more, stiff and slow, having more balance and walking problems. And so if you're experiencing that, you definitely want to be talking with your provider about, how you can some of that wearing off or the off period, and therapy can help as well, just to come up with strategies to move better during the off times. Another problem that we tend to see over time is freezing, also known as, well, it could be described as just sort of a temporary inability to move, feeling sort of frozen or stuck in place. A lot of times this happens when someone is initiating a movement. So like getting out of a chair can also happen whenever you just break up the natural flow of movement. So like if you're walking through a doorway, if you're walking into an elevator or into a crowded room, people tend to experience freezing or festination, which is when you get really, really like short shuffling steps and you have a hard time picking your feet up. But there are a lot of strategies for managing freezing as well. I included a link here which is a link to a Parkinson Foundation website that has lots of tips for managing freezing and videos as well. And this is also something that we work on a lot in physical therapy. So next we'll talk about maintaining quality of life in Parkinson's disease. And there was a big study that tracked a lot of people with Parkinson's disease in different countries. Some of the key findings were that number one, negative mood and depression have the greatest impact on health status. And again, that's why I mentioned earlier that it's really important to bring up those non-motor symptoms with your provider since they really can have an impact on quality of life and health. And then number two, impaired mobility is the second most influential factor on health status. So those are sort of the problems. The good news is that exercise can actually help with both of those problems. So research has shown that exercise can improve mood and cognition in people with Parkinson's disease, and exercise can improve mobility, including walking, balance, posture, flexibility, endurance, and strength. And not only does exercise help, but inactivity actually hurts because it can promote more degeneration. And so even more so with people with Parkinson's disease compared to the other patient populations, we talk about exercise as medicine because we know it is so important in managing the disease process, and it can even help to slow the progression of the disease. And so we ask people to think about exercise as though it is medication, and just like you wouldn't, skip your dose of Cinemet or carbidopa-levodopa, you really have to think about, scheduling and dosing your exercise every single day to keep you moving optimally. So next I want to talk about some specific types of exercise that are recommended for people with Parkinson's disease and sort of how much of each type of exercise we recommend. So the first type of exercise is cardiorespiratory or aerobic exercise. And so in this type of exercise, you're trying to get your heart rate up and keep it elevated for an extended time period. The recommendation is to exercise for at least 2.5 hours, and that would be moderate intensity exercise at least per week. You could think about doing this in continuous sessions. So let's say like 30 minutes of exercise 5 days a week. Or it could even be broken up into shorter sessions, like 10 minutes, 3 times a day. In general, we always tell people to start slowly and gradually add more, and know that any exercise is better than no exercise. So if you're really new to exercise, especially like aerobic or cardiorespiratory exercise, you may even just feel up to doing 2 or 3 minutes and then build up to 5 and then 8 from there. But anything is better than nothing. And I should also add that if you are new to exercise or if you haven't exercised in a long time, we certainly recommend just checking in with your doctor to make sure that there aren't any problems that would prohibit you from safely exercising, especially if you have heart or lung issues. So the next type of exercise that we'll talk about is resistance exercise, also known as like strength training. So a lot of times when people hear about resistance exercise, they're thinking about, I need to go to the gym and lift weights or use like dumbbells or weight machines. But there are actually a lot of ways to work on strengthening that don't involve dumbbells or going to the gym. A lot of times you can use, your own body weight for resistance training. So we think about doing things in, maybe hands and knees position or bearing weight through the wall in like a push-up position. We commonly will prescribe exercise bands for people to use at home when they're doing strength training, so you don't necessarily have to go out to the gym. So we recommend that you work we recommend that you do resistance or strength training 2 or 3 days a week. And the recommendation is to do 2 sets of about 8 to 10 repetitions. And if you are really fatiguing the muscle, then we recommend waiting about a day or so in between doing the exercise for that muscle group. So let's say you work on your leg muscles on Monday, then you would want to wait until Wednesday to do to work those same muscle groups again. For people with Parkinson's disease, we tend to really focus on working the muscles in the back of the body. So like the muscles around the shoulder blades, around the spine, the glute muscles, the hamstrings, and the calves, because over time, people with Parkinson's disease do tend to come into more of like a rounded posture. And so having good strength in the muscles in the back of your body will help to counteract that. And those muscles in the back of the body are also really important for being able to walk well, and especially walk on different types of terrain. So the next type of exercise is flexibility exercises. So these are like stretches. And we recommend doing flexibility exercises 2 or 3 days a week, although it's also fine to stretch every day. That won't hurt you. Stretching is particularly important for people with Parkinson's disease because one of the most common symptoms is stiffness or rigidity, especially in the trunk and the neck muscles. So we want to keep those muscles as loose as we can. The other thing is we really want to keep the muscles in the chest and the hips nice and loose so that you're not pulled more into that rounded posture. So when you're stretching, you should be holding the stretch for about 30 to 60 seconds, at least 30 seconds. And you want to go to the point of tightness or slight discomfort. If you're really working on a muscle group that's tight and you want to be elongating, it's a good idea to repeat the stretch several times. And keep in mind that stretching is most effective when the muscle is warm. So you want to do the bulk of your stretching after you've exercised. And then the last type of exercise that we'll talk about is neuromotor exercise. And so these are exercises that involve motor skills like balance, agility, coordination, and gait. Some examples are dance, Tai Chi, yoga, boxing. We also have some exercise programs that have been specifically developed for people with Parkinson's disease. One is called LSVT BIG. That stands for Lee Silverman Voice Treatment, BIG, because we're working on making really big movements. And the other one is Parkinson Wellness Recovery. And that's also a program where we work on doing kind of more intense and big movements. And the therapists go to courses and get trained in teaching LSVT BIG and Power to patients. And we have a lot of therapists at our clinic who are certified in LSVT BIG. And I'm also certified in Power. And there are therapists on the Raleigh side of the triangle as well who have those certifications if you wanted to learn some exercises specifically designed for people with Parkinson's disease. So we recommend doing these exercises 2 or 3 days a week, although in some cases we recommend that you do them even more often, up to daily, and 20 to 30 minutes a day is appropriate. So this being said, I know I've just said you should basically be spending your entire life exercising. That's probably how it feels. Who has time for all of this exercise? And so I think it's also important to note that like this can be quite overwhelming. So if you're thinking, how in the world would I come up with a program that encompasses all of this type of exercise? Physical therapists are really experts in exercise, and we'd be happy to work with you to come up with a program that incorporates these types of exercise or that really works on your specific impairment. So please come and see us. And then the other tip is really what I talked about before, just starting slowly and adding on exercise over time. And I should also mention that physical therapists have different specialties, just like physicians do. So like I specialize in physical therapy for people with neurological disorders. And we also have therapists who specialize in treating people with orthopedic disorders. So the more that you can find someone who specializes in treating people with Parkinson's disease or people with neurological impairment, probably the better your outcome will be, and the more satisfied you'll be with your course of physical therapy. So I also want to acknowledge that it can be difficult to get in all of this exercise when right now we're supposed to be, staying at home, doing social distancing, gyms and group as options are not available. So I want to share these resources so that you do have some options for exercising at home. And most of these are, things that you do online. And so that second resource there, the YouTube exercise videos, I want to say that Katie Stevens did one of these webinars a few weeks ago and really talked about how you can use YouTube to find exercises that are exercise sessions that are really high quality. And she goes through it step by step. It's really an excellent resource. So if you're not sure how to use YouTube or what you should be typing in to find some good exercises, please take some time to listen to her webinar and her talk. I also have listed 2 exercise resources that are very Parkinson specific. So the first one is a Fitness Fridays exercise series through the Parkinson Foundation. And this one takes just 12 minutes and it's taught by a physical therapist who is highly trained in treating people with Parkinson disease. And then the last one there, the Parkinson Wellness Recovery YouTube channel, works on, leading you through some of the Parkinson Wellness Recovery exercises. And they also do some general kind of aerobic training. And they also have just wellness content on there also. On the handout, the resource handout that I added to the presentation, there's also a link for Dance for Parkinson's because they have some great videos right now. They do movement labs, dance classes, and singing classes. So hopefully, you can find something that feels good for you online, even if you can't do your preferred form of exercise, like actually in person right now. And we hope that exercise is fun for people. If you really hate exercising, then I recommend that you try and find a different form of exercise. So it doesn't have to be, going to the gym and riding a bike. It could definitely be doing a dance class or boxing, non-contact boxing. We have a program that's for people with Parkinson's disease, for example. So next, I just want to touch on preventing and preparing for hospitalizations because, of course, with the COVID pandemic, people are, going to the hospital more suddenly than they anticipated. And so it's always good to be prepared. First, let's talk about preventing hospitalizations. So a lot of these tips are, recommendations that have been given to the general public. I think it's useful to point out that you really want to be working with your doctors just to manage chronic medical problems. Hopefully there are telehealth options or they've put in, measures so that you can safely go see your providers in person as well. It's also really important to maintain mobility so that your risk of falling is decreased. And if you are noticing more difficulty with walking or balance and you want to see your physical therapist, we, like at UNC and I think at other clinics, are offering telehealth right now. We are also offering in-person visits at UNC. We have a lot of measures in place to keep everyone safe, like using masks and extra cleaning in the gym at all times. So another option for just like maintaining mobility and safety and health is working with in-home care providers. And these are people who can do home safety assessments, help with medications, and also help with exercises. So even if, you only feel comfortable going to the physical therapy clinic once or twice, you can learn a program and then someone in the home could help you carry out that program. So in terms of just preparing for hospitalizations, the Parkinson's Foundation has a big campaign related to making sure that people are able to advocate for themselves, especially in relation to getting the medications on time in the hospital. And it can be really problematic for people with Parkinson's disease to go to the hospital because a lot of providers don't know how important it is that you get your medication on time. And so, maybe that medication for cholesterol, it's okay if it comes an hour later or even a couple of hours late, but if you don't get your medication for Parkinson's on time, there are going to be a lot of complications. So you can order this Aware and Care Kit from the Parkinson Foundation. and I have a link in the handout. So please look into that. It gives you a lot of tips and also just really helps you and your care partner advocate for you if you end up hospitalized. So here are some references if you want to look into anything that I was talking about a bit more. And next we're going to talk about our case. So we'll be talking about our person with Parkinson's, known as Mr. Peter Parkinson's. So I'm going to tell you about sort of what the scenario is, and then we'll each describe what we could do to help this gentleman out. So Mr. Peter Parkinson's is a 70-year-old man who was diagnosed with Parkinson's disease in 2012. Currently, his main problems are slowness of movements, tremor in his left arm and leg, and feeling off balance. He's had 2 falls over the last year. One occurred when walking to the bathroom at night, really common time when people fall, and the other when walking down the stairs. So this gentleman finished a course of outpatient physical and occupational therapy last fall, and he was supposed to go back to the clinic for a tune-up this spring, but he was unable to attend in-person sessions because of COVID-related clinic closures. So he was also going to the gym twice a week with his wife and riding on the bike, but he hasn't been able to go because his gym is closed. Recently, he started feeling more isolated and he's having a harder time motivating himself to do his physical therapy exercises. He notices that it's taking him longer to get dressed in the mornings and it's harder to get out of chairs and to move around in bed at night. So Mr. Peter Parkinson's is wondering what he can do to get back on track with exercise and to help with his mood and the anxiety he's feeling about his health and about the future. So I'll start off by talking about sort of how I would manage Mr. Peter Parkinson's at the moment. So I think the most important thing is to help him get back into one of the most important things I should say is to help him get back into that exercise routine. So his gym is closed, or perhaps his gym is opening, but he doesn't feel comfortable going back to the gym. One thing I was thinking about is that, he said he was going to the gym with his wife previously. And I think that, having an exercise buddy can really help to like stay consistent with your exercise routine. So perhaps he and his wife could think about, scheduling a time for exercise together, even if it's not at the gym. So maybe, if they were going to the gym on Tuesday and Thursday, they could think about instead taking like a brisk walk on Tuesday and Thursday to get that aerobic exercise in. And then, if he's supposed to be doing his exercise every day, his Parkinson's exercise, perhaps his wife is also, doing some strengthening routine, and maybe they can set aside a specific time, like after breakfast every day, where they both do their exercises. If this doesn't work, perhaps there's another, friend or family member or an in-home aide who could also help to just kind of schedule this exercise and make sure that it happens. I would certainly want to see him back in the clinic, whether that's, virtually or a phone visit or an in-person visit, just to check in and assess his balance and his walking and see if we do need to work on different exercises that I could prescribe for home, or if he needs sort of a tune-up and how we could make that work for him. And then I would want to just make sure that we're talking about what's going on with his mood. Find out whether, maybe he just needs to get more into exercise and maybe that'll help with his mood. Or do we need to think about, getting more of an assessment with a counselor, or talk more with his primary care doctor to see if he needs to address that with someone who specializes in helping people with anxiety, depression. And that's something that we're all dealing with right now. So I'm going to stop sharing my screen and then we'll pass it on to our next panelist, who is Gina.
Okay, I've got it. Hang on. Did you stop sharing?
Stop share. Okay.
Excellent. All right.
That was great information. That was wonderful.
Great. Thank you. I'm glad.
Let me just get this all.
So we, as healthcare, we work as a team with the therapist. And there's no greater joy than when we're working with a client who has home health, has working with physical therapy, because we have the caregivers that can do the follow-on. We can be the exercise coaches, because sometimes it's easier for a non-family member to be the one to get them going again. It's like, my wife's nagging me. She keeps nagging me that I have to do these exercises. So we have caregivers when they are assigned to someone with Parkinson's or any specific diagnosis, we give them education about that disease, how important the exercise is. Because if it's just on a list, it's like, oh, exercise reminder, okay. But if you understand that it's going to dramatically improve his quality of life when he does his exercise, it has more meaning to it. In fact, our caregivers actually exercise with our clients. They know the big movements, and they're like, come on, let's work with me. The caregivers also understand the importance of the medication and the timing of it, that it's not okay to let it get to be 12:30 if you're supposed to be taking the medication at 12. A big role caregivers can play, especially during this time, is to give that spouse or primary care partner a break. We're all home, we're not going out as much, even though we can. We want to give that wife who might be just a little bit tired, even if she just wants to go into the other room and read a book or just do something by herself. It gives socialization to the client. And quite frankly, some of the spouses enjoy the caregivers just as much as the clients do. Overnight, we heard them fall at night. We have caregivers that can work overnight. And sometimes if the spouse or the loved one can have a good night's sleep, they can handle all the daytime routines. So our caregivers, they don't sleep at night. They're awake. They're working all night. So they can be the one to get up with him if he needs something and prevent the fall. They also can do household tasks during the night, so they can do laundry. They can prepare dinner for the next day. So they're at work while the client and wife may be sleeping, and the client gets up. They're there for safety and just to be with them. So we are very careful with our caregivers. They have to go through screening questions before they go to work. They get reminders the day before. If they have any respiratory symptoms at all, of course they don't work. They all have masks. We went through re-education about hand washing, infection control, being careful. We in fact limited, our caregivers are not allowed to go shopping for clients right now, so that they limit what they do. We also limit who the caregiver goes to see. So they're not going house to house and seeing multiple clients. Like I said, we love working hand in hand with the therapists. And there's times where the family's just at odds, and maybe Peter here and his wife are doing okay, but you have adult children from out of town and they all have different roles, they have different ideas. Sometimes you really need an aging life professional to kind of pull it all together and get everybody on the same page. So with that, I'd like to turn it over to Micah and let us know how can you help this gentleman and his wife?
Thank you, Gina.
Am I?
Yeah, you're good to go.
I am. I know. I think we were mutually muting and unmuting at the same time. Well, thanks, Gina. That was a great segue. And I think you're exactly right. We come at it from a more holistic standpoint. We, as geriatric care managers or aging life care professionals, are a privately hired, private pay advisor or consultant, an expert consultant, and we come alongside our clients and their care partners to really take a holistic look at their situation. So while Mr. Peter Parkinson might come to us with this very specific concern, when we meet initially, right now we still are able to go see our clients. We do some work telephonically, but we do, if we feel it's beneficial and safe to do so, we can do an in-person assessment, oftentimes in the client's home. And we would then discuss what brought them to us, which is the list of problems we were given, but we maybe also will identify some other issues that come up in that assessment. So we really look at the home, we take a look at the safety of the home, and we determine if maybe there are concerns of the setup and the accessibility of the home. We talk about who is your care team, who are your doctors, who are the specialists that you are working with, and determine if those are the best fit. In this case, we would check if the doctors that Mr. Parkinson works with are knowledgeable in the area of Parkinson's. Is he well connected in that area? We oftentimes will refer to the Parkinson clinic or other specialists to make sure that whoever advises them in that area really is well skilled in that diagnosis. Same with the OT, PT team, making sure they have a good connection there. And then identifying what else do we see? You know, we have nurse care managers that can review medication. And then if they see any red flags there, that can be addressed. We might learn in our assessment that Mr. Parkinson has been having issue with transportation and it's been difficult to pick up medications. So we might be able to assist with some issues that are, you know, at first sight unrelated to their concerns, but as professionals, we come in and really look at that whole picture and see, you know, where are some other things that we see that might improve their overall quality of life and quality of care. We would likely discuss with them the resources that we can put into place. You know, a goal without a plan is just a wish. So we really look at what are your hopes, what are your desired outcomes, and how can we get there? Many folks are great about doing their research, but as professionals, we, you know, all nurses and care managers that have worked in this field for many years, so we can steer our clients toward or away from resources that we feel are a good fit for their situation. We can look at their funding sources, you know, what can we afford to put into place? And that might be some home care through Aware Senior Care, that might be other resources. If this Peter and his wife might be thinking, how long can we stay in our home? You know, in the current light of the COVID pandemic, a lot of folks are nervous about eventually having to move into a facility. We see a lot of, you know, about that in the news, that a lot of infection is happening in congregate care settings. And so a lot of folks really want to age in place at their own home. So we can really come alongside them and assess which supports are necessary to safely age in place. And that might be connecting you to a certified aging in place specialist. There are people that actually are certified in coming in to make sure the home is as accessible and safe as it can be. So we kind of know the various experts in each of those areas of support that we can bring together and create a village. And I speak to that in my last point, it takes a village. So we really look at who all do we need to bring on board to make sure the person is receiving ideal support. But then also, we oftentimes kind of fill the gaps because it is a private pay service. We can really fill in those holes in the care net that, you know, each person kind of has their area of expertise, and we can come and fill the gaps that are usually always there, making sure that everybody communicates with each other, making sure nothing falls through the cracks, making sure doctors communicate with each other, making sure that discharge instructions are followed through on, and then working with the family, as Gina had mentioned. You know, if we find right now, we've seen an uptick in people coming to us for support that previously had family members, adult children, or friends that would help them out, but currently they can't travel, or they are critically, have critical health conditions themselves, so they have to self-isolate. So we can be that support and can step in and assist with coordinating appointments, attending appointments, providing transportation. And so we can also then be the boots on the ground and the eyes on the person for those members of the support system that might right now have to take a step back. And then we work with a lot of clients that don't have family or have no adult children to fill that role. So we take on that role of being that support system for that person. So in Peter's case, his wife maybe that support, but she may also have a heart condition and right now doesn't want to take him to the doctor. So we can then be that person to take that off her plate and handle that piece, as an example. We would also do some creative out of the box thinking, you know, maybe we can get a caretaker to come walk outside with him in a place that is going to be low risk, to make sure he gets some sunlight, make sure he gets exercise, and that might help some of the mood issues and getting back into that more active place. But certainly connect him and his wife to all those support people that are necessary and kind of pull it all together and make sure it's all cohesive. And then I'll hand it over to the next specialist, Susan, to see how she would assist.
All right, thank you, Micah. That was awesome. All right, Susan, you're the closer.
Okay. I'm going to actually look at some really specific things with Peter. Peter has found that it's very challenging, not only in his mobility, but also in the fact that when he goes outside, he has to wear a mask. And for us, any of us that go out wearing a mask, or I'm finding it personally very challenging. So I can't imagine how it is for other people that may have mobility issues as well as difficulty projecting their speech. So a couple of things, doing some research I learned is when we go out and we're wearing a mask, our range of vision is impaired. And how I discovered this was I almost tripped over a curb because our vision below is blocked by that mask. So I have learned to make sure that when I do wear a mask, that it's tight enough, but not that I can't breathe, but tight enough that it's not loose and it's in the way of me actually having my vision, my lower vision. And what happens with our lower vision now is we need that because stores are putting the marking and what direction, what arrow you're supposed to go or follow is on the floor. So we need to be looking down when we're trying to socially distance and follow what those businesses are asking us to do in their premises. So I found that to be very challenging. The other thing is when we have a mask, we have difficulty projecting our voices. And my mother-in-law has double cochlear implants. So normally my voice is low enough, she can't hear me. And with a mask, it is almost impossible. And I know that folks with Parkinson's have at times difficulty projecting their voice. So in Peter's case, Peter's having difficulty projecting his voice, especially when he has a mask on. So what can he do? Well, what I learned is there is a wonderful free app, if you're not aware of it. And this free app is called, I've got it down here, Live, I think it's Live, hang on. Oh, am I not finding it? Live Transcribe, and it works on a Android, and I actually tried it. It's a free download that you can put on your phone, and I put on a mask, and I stood back 8 feet from my phone, and it still translated on my phone in nice large print everything I was saying. So it is a tool that you can use to take with you, and when you're in a situation where you either can't hear the other person or the other person can't hear you, you can easily turn on the app. You don't have to talk on a telephone conversation. It's just an app on the phone. Just tap on it and you can actually see in written words what is being said. And I found it very, very helpful. The other thing is that some of the articles have suggested if you're not comfortable wearing the mask out in public, wear it around the house first and get used to the range of vision that you have with it and your mobility with it. And then also for folks with Parkinson's disease, you want to be going out in public when you've taken your medication, because if you're at the waning time of your medication, you might be more prone to falling. So by going out at better times of day when you've got maybe first taken your medication and it's first kicked in, might be more helpful and keep from falls or tripping. But that's just a couple of things I learned. As far as the depression and anxiety that I mentioned there, with this gentleman, what I would suggest to Peter is to try and line up with his family some virtual visits, either Zoom or one of the other programs. And they say that folks that are actually interacting with their loved ones or friends on virtually, it helps with their anxiety and depression because they're feeling more a part of the community. And I thought that was a helpful hint. And the other thing that they also mention, this article comes from the American Journal of caregiving, where, anyways, I've got it listed there for you. But anyways, in the article, it talks about the fact that telehealth is extremely helpful. And if you are having depression and anxiety, to look at those professional resources and using telehealth. So some of these things were covered, and I appreciate you guys covering, but I just wanted to mention that again. So that's all I've got. Thank you.
Well, thank you, Susan. Just for everybody on the chat, you may have noticed that I pushed out on chat the PDF of this presentation. And the value there is, you can see there's a lot of links that presenters have provided. They should be hot, meaning you click on them, you'll be able to go to the source or at least type that in. The second is that Deirdre was kind enough to put together a resource document and push that out on PDF. We will also make them available on our resources on our website as a backup. So this concludes at least the presentation part, and we want to wrap up the next 5 to 10 minutes with a Q&A. Feel free to type in and chat a question. I'm going to turn it over to Micah to chair, because I know we had some questions that have come up. So Micah, I'd like you to take Micah K. Or Micah. Well, there's, but well, everybody gets it. Micah, go ahead and kick off the question and answers period, please. Thanks.
Absolutely. And as Tim was saying, please feel free to continue to type in any questions you may have in the chat. But we did have a few come in already, which is really great. So it's actually for Ms. Deidre. The question came through, so what happens during my first physical therapy visit, and how is it that a PT is different from a personal trainer?
Yeah, sure. So during the first physical therapy visit, we do an evaluation. So we talk about, what are your goals for physical therapy? And then we take a look at your walking, your strength, your balance, and then we come up with goals and decide what we want to work on in physical therapy. So the first visit is a lot of talking and some testing, and then more talking. And we decide what our plan of care is going to look like. So, do we just want to come back and do a visit or two so you can learn a home exercise program? Do we want to do something more intensive? Sometimes we even do, 4 times a week for 4 weeks. Or, do we want to plan on having your care partner come to one of the visits so that we can learn some home exercises? So during the first visit, it's mostly assessing and planning. And then the next visits, we work on treatment. And so physical therapy is different from physical training because as a physical therapist, we're doing more of the evaluation component and sort of evaluate and reevaluate, make sure that we're using really skilled interventions. And then in physical therapy, in order to continue, we need to be providing skilled level of care versus just kind of going through the exercises with you. So at some point, then we will, have you do your exercise program on your own, and that might look like, you doing it by yourself or having someone support you in doing the exercise program. And then we often will have people check in regular intervals just to follow up, make sure everything is going well. And then if we need to do another round of physical therapy, or if everything looks great, check in another time in, 3 to 6 months, let's say.
Thank you very much. The question came in for Micah W. Aging Life Care. So how's it that you all would work with a home care agency? Like how does that work together?
Sure. We over our careers, we've worked with many different home care agencies, and we are familiar with how each agency works, and they have different hourly minimums, different hourly charges, different specialties. We've had experience with a variety of home care agencies, so we really have screened and have found vetted, trusted community partners that we prefer to work with just based on our experience. So after assessing the need and the appropriateness for home care, we then assist with that referral process. We assist with that initial connection and the assessment process. And we can then also be an extension of the home care agency in working with staff and doing some coaching with staff if that is desired. Being an advocate for the client. If we see any issues with caregivers or there is any grievance, we can be kind of a mediator and make sure that any issues are resolved. So we can kind of help from that first referral and then assist to make sure it's a successful placement.
Awesome. Thank you so much. Same person had a follow-up question for Gina. And so then the question is home care covered by medical insurance? How much does it typically cost?
So home care is non-medical by nature, even though we do help with bathing, dressing, and all that. That's not considered medical. So our services are not covered by Medicare or any medical insurance right now. Medicare rules are changing. Some Medicare Advantage plans are starting to pay for some home care. We do. If you have long-term care insurance, we'll file claims for you if you meet their criteria. So typically, it's an hourly rate for us. So companion care where there's no hands-on help, so it's household tasks, transportation, meal preparation, that's $24 an hour. And then personal care or folks with living with dementia that need even companion care, it's $26 an hour.
Okay. And are you able to provide what level of assistance? In other words, what's the variety of the shifts is what they're asking. Like, what's their minimums? How much can you do?
So we do minimum shifts of 4 hours out in the community. We are in some communities where we do very short shifts. So we can do everything from just light helping with the shower to we take care of folks that are bed bound. We take care of them around the clock. So anything from 4 hours to 24/7. But we also have nursing services on our license also, so we can help out with that too if that's needed.
Excellent. Thank you. Ms. Susan, you had provided a lot of excellent resources. Someone's asking, how do I find more information about getting help from resources for seniors?
Good question. Resources for seniors, you can find us online, and also you can call our direct number. We have somebody there all the time right now answering the phones Monday through Friday, 8 to 5, and being able to address questions. And that is 919-872-7933. I'll do that slower. 919-872-7933. You also can call any of the senior centers in Wake County, and there is a representative, either full-time or part-time there, for resources for seniors to be able to provide information and assistance. We cover things like transportation, meals, housekeeping, weatherization, home improvements, home repairs. We have several departments, and each of these departments is based on grants that we've received because we're a nonprofit. So depending on the income, it may be that some of these services are actually provided free. And our role and responsibility is to help direct you to those services. So in the case somebody was to call and ask about a home care agency, we would listen very carefully to what their needs were and what they're looking for as far as location or services. And then we help them with questions that they need to ask the agency they're looking at talking to, so that we're helping them be what I call an informed consumer. And then when we can provide services through our grant-based programs, we also direct them to our intake folks so we can see if we can get them into those programs. Thanks.
Good deal.
Micah, maybe I have time for 2 more questions.
Okay, one came in, Ms. Deidre. So my loved one has Parkinson's. They have a cane that's not working very well. So what would you say is the best type of cane or walker for someone with Parkinson's?
Yeah, so typically the best, most effective type of assistive device for somebody with Parkinson's disease is a rollator, one of the devices that has 4 swiveling wheels, so 2 in the front, 2 in the back. That one tends to help people walk smoother and avoid those moments when their gait is disrupted, and then they get more into those freezing episodes. Sometimes we do work with people on using a cane or other types of walkers or other types of assistive equipment, but most often we recommend a rollator if somebody needs, you know, a device that they hold on to with 2 hands.
Very good. That I believe that was the last question that we had, unless we had one final question. But I believe that was the last one. Thank you all so much.
Okay, I'm gonna stop my share here and stop my video. Hi, hi everybody, we're back. Well, listen, I want to first of all thank Deidre for an in-depth insight to Parkinson's. Gene and I attended Teepa Snow's training, and part of it not only is about dementia, but how to be a good trainer. And every session he asked, what was your aha moment? Well, mine was exercise. And really, you think in life, there's constants, whether it's diabetes or dementia or Parkinson's. If you exercise, that's a good thing. So if you walked away with one thing from this presentation, it was really fun to do. Just said, I'm exercising you to all, you know, whatever. But that's terrific. But thank you, Micah W, for
being here.
you know. I hope an aha moment for some of you is the amazing resources that are available to you. And it is a strength to reach out for help, not a weakness. And an aging life care professional is kind of like that life coach with senior expertise and a variety, and they can help you build your circle of support, which would be Deidre, it could be us, it can be Susan, it could be your pastor at your church. You know, build that circle to get as much joy and get help from people who really understand their various areas of expertise. And when you think about it, we've been doing this now, this is number 7 webinar since COVID. And I know we've touched a lot of lives, and it's all about educating people there are people to reach out. There are people that want to help. So, you know, thank you to this team. And closing thoughts, I hope everybody got the presentation over chat. If you didn't, no worries. We will post it on our website. If you click on resources and download, you'll see it. I think we also have everybody's email, so we can follow up with a link to this recording, because there's a lot of people that probably didn't make it. If you have suggestions for other topics, fire away, and please contact Micah or Deidre or Susan for help. So with that, I want to wish everybody a wonderful, happy Friday. And God bless you, and have a great weekend.
Thank you.
Thank you.
Thank you, everybody.
Great weekend.
Thank you.